We're joined in studio during this half hour of the program by Russell Singleton, a physician assistant from Tripp Family Medicine here in Twin Falls. Do want to point out the office is located on Fillmore Street, directly across from the main post office. And we should also point out that Dr. Tripp and his staff are still looking for new patients. And as a patient, we like to remind people that generally, if they call in the morning with a medical issue, they can get in on the same day, but if not, within 24 hours or so. First of all, Russell, welcome back.
Thank you. Good to be here.
It's been a while since you've been in the rotation.
Yeah, we're getting big enough to where I can only come see you once a month or so.
Yeah. We're having a conversation off air, serious conversation about cancer screenings and some things people should know. I was telling you a little bit about family history and the like, and but in this day and age, with so many different factors out there, environmental factors that could be involved with it, it's always a good idea that people keep tabs on these things.
Yeah, and that's what I wanted to talk about today. I thought we'd maybe go back to biology class and talk a little bit about what cancer is and how it functions. I have a list of things that people believe to be true about cancer, whether it's the diagnosis or treatment of cancer. Some of those, or actually a lot of them are not true, so we'll debunk those. And then lastly, I think we ought to talk about what we can do to prevent it, and usually that has to do with screening.
Well, when I was in school, this is going back to the late 70s, but they used to tell us there were seven warning signs. Do we still have seven, or how does that work?
Well, there are actually well over 100 different types of cancer, and so it's hard to lump them all together. There are what we call constitutional symptoms when people have sudden unexplained weight loss. They have night sweats, for example. Those types of things are concerning for either an unusual systemic illness or something like cancer. But there are some types of cancer that cause no symptoms at all, and actually those are the most deadly. Your melanoma, for example, if that's growing, let's say on a scalp under the hair, you may never see it, you'll never feel it until it's already spread. Pancreatic cancer is very much that way too. It grows so quickly that by the time you have some abdominal pain, it's already pretty late in the game.
I had a fellow I was acquainted with. He was a radio talk show host in Baltimore, Maryland, and I used to occasionally email back and forth with him. And he had been in the Marine Corps, healthy as a horse, and then suddenly, when he was diagnosed with pancreatic cancer, it was already stage 4, and he was gone within 2 months or so. And not long after that, I learned that another friend of mine, who I'd known when I lived in Vermont, had been diagnosed about the same way. And again, the survival rate, she was gone within a couple of months. But this is because, again, there really, if you go to the doctor's office and unless you're cutting someone open, there's no way to know in many cases they would have this.
Well, and that's why we've developed certain screening activities for certain populations at certain times in their lives because we know statistically that certain folks are going to be at higher risk. For example, we could talk about prostate cancer. That was something that up until recently was pretty commonplace for a man in his 50s. But as we've developed that technique further, as we've learned more about it, we discovered that we weren't actually saving very many lives. We weren't picking up on prostate cancer a whole lot faster, and when we were, it wasn't changing outcomes. So that's an example of something that we've actually abandoned because it just wasn't worth it. It wasn't working.
Well, you talk about ways that you can look back on this too. And a thought just came into my mind. If you had someone who moved here and they'd lived their whole life in, let's say, Hannaford, Washington, um, speaking of environmental concerns, they had their environmental concerns because of the nuclear issues there. Would you recommend that that person, for instance, get some closer screening? Or someone who may have worked even a brief period in a mine, anything like that? Should they take a few extra precautions when they come in and see you every 6 months or so?
That's a good question. So I think there are certainly occupational exposures. So I think we've all probably heard of the cancer that can be caused by exposure to asbestos.
Hmm.
So if you work in the construction or maybe demolition, folks that worked at shipyards a generation or two ago would be at high risk for that. There's some industrial chemicals that can raise risk of cancer. We were just talking about geography. I don't know that I could really answer whether or not living near a nuclear plant would increase that risk, but sometimes you hear people joke about being born under power lines. That actually is not, as far as we know, not a risk, as are cell phones. The level of energy is such low frequency that they don't have the ability to cause a genetic mutation, which is really the core definition of cancer. It's a genetic mutation that causes cells to divide in an unregulated manner.
I had exposure to asbestos. I was sanding some walls after hanging some drywall many years ago, and then realized after 3 days of sanding that there was asbestos in the materials that I was using. And I hope that 3 days is not what you'd call the threat, but you never know. We've got to take a short break. It's coming up on 20 minutes from 9 o'clock, and then we'll get into some more detail about this with our guest, of course, physician assistant Russell Singleton from Tripp Family Medicine. And in the following segment, if you have a question or comment about the topic, and most people have had someone they know in family or friends who have been touched by cancer, feel free to give us a call too as well. It's 33. You're listening to Top Story as well. We're joined in the studio by physician assistant Russell Singleton from Tripp Family Medicine here in Twin Falls. Bill Colley with you answering the telephones. We're at 33. It's 842. Better health with Tripp Family Medicine. They have a slogan, life's too short not to feel good. And cancer is one thing that will make you feel rather blue. And so we're talking about some issues related to that this morning. First of all, if someone would like to get in touch with the office, how do they go about doing it?
933-4400. If you call us early in the morning, there's a good chance we'll get you in that day or certainly the next day.
We like to remind people, though, good chance means not always chance.
Yeah, we are a traditional family medicine practice, so we're not an urgent care per se, but we have decided to grow with the demand so that we can give our patients that same day access or pretty close to it.
And if somebody calls in and they've got a fever of 104, you're likely going to see them. Where if they have a maybe 100, you might give it a day.
Yeah, I think that's a good point too. We do try and offer some triage over the phone and take cases that are maybe a little bit more time sensitive, and we appreciate the relationships we have with our patients to where they understand that, if we're running a little bit late that day, it's probably because we're talking to the patient right before them about cancer, for example.
We have a caller with us. I do want to point out telephone number to reach our studio, 208-736-0300. Caller, you're on the air with Russell Singleton. Go ahead.
I was just wondering if there was anything to worry about. For a year or two now, doesn't matter what time I go to bed, I'm awake at 3 o'clock in the morning, and not always bright-eyed and bushy-tailed at that hour, but I don't seem to be able to sleep longer than that.
Okay, that's a good question, and I think it's one that probably affects a lot of people. So the first thing that comes to my mind is that as we age, our circadian rhythm changes a little bit. We actually need less sleep. When you're a child or a teenager, you probably need about 10 hours. As a midlife adult, closer to 8, but that even decreases as we age. And so we'd want to consider that. The next thing that comes into my mind is the environment. Is there anything in the physical environment that's causing that interruption? Sometimes people wake up in the middle of the night because of pain. Or in the case of this gentleman, perhaps he has to use the restroom, and perhaps there's a prostate issue that if we correct, he'll actually be able to relax and get some rest. Another thing I wonder about is stress, anxiety. I have a lot of patients that say they either lie in bed at night trying to fall asleep, or they'll wake up in the middle of the night with their mind racing, and they'll be just ruminating over things that happened during the day or things that they need to do. And last but not least, I think I'd mention sleep apnea. There are folks who have such a crowded airway that they snore. They snore heavily, and that causes decreased levels of oxygen to the point where the brain is going to snap you out of sleep to get you breathing again. And so we'd want to talk about that. Is he at increased risk because of neck circumference or weight? Again, snoring. Does he have high blood pressure? Does he wake up with headaches? These are all things that we could use to try and identify whether or not he's at risk for sleep apnea. As far as cancer goes, though, I don't know that that would be the first thing on my mind.
I want to thank him for the call. You referenced quickly the sleep apnea. Uh, I have a brand new CPAP machine, and I have a black and white furry creature that lives in my house with me. And the black and white furry creature likes to play with a hose in the middle of the night, which wakes me up, which sort of defeats the whole purpose. But speaking of which, the way your brain function works, if you aren't getting certain, you do have issues. It can affect your overall, what's the word that they use, holistic approach. So, it's not going to help when it comes to the development of cancer. I mean, there could somehow be a correlation there.
Well, I think that lifestyle does contribute. We know for a fact that if you're under a lot of stress, we off air were talking about how some people smoke because it's a stress reliever. Well, that unfortunately is going to raise your risk dramatically for cancer. Our diet, if we eat a lot of processed foods, if we overeat in general and we're overweight, that raises our risk. Um, and then, of course, there's the occupational exposures we talked about. There's the fact that a lot of these things are inheritable. But if if there's one thing I could say to our listeners, it's that I ask you to have a yearly exam with your healthcare provider, with your doctor or your PA, and talk about any relevant cancer screenings. Because as we've already pointed out, this can affect almost anyone. It doesn't matter if you have a family history. In fact, I think close to half of us, if we live long enough, are going to be diagnosed with some type of cancer. And you might not have symptoms right away, and there might be modifiable lifestyle factors that we can work on now.
You referenced that if you live long enough. Well, when Adam West passed away a few months ago, it was quite a surprise because not long before that he'd been hosting an art exhibition up in Ketchum, and he seemed his usual jovial self. But he was nearly 90 years old, and suddenly was diagnosed with leukemia and was gone very quickly. So once again, whatever happened there, the onrush of it, and I'm sure he saw a doctor on a regular basis. It's not like he couldn't afford it.
Yeah. Well, that's an interesting point. I do think the statistics show that it's probably actually closer to 40% of men and women will be diagnosed with cancer at some point in their life, and that's incredible. That is almost 50%. For a long time, heart disease has been the number one cause of death in the United States, but as medical care advances and we live longer, it actually comes down to cancer. Those cells will grow in an unregulated manner until they start to form tumors. Now, leukemia is one where there is no tumor formation, but when these tumors grow, they can spread, and as they grow and spread, they inhibit organ function. So if you develop a mass in the lungs or a mass in the liver or a mass in the pancreas, eventually that organ is going to stop function. And that's what actually leads to death in cancer. It's not the cancer in and of itself, it's the effect on the rest of the body.
We have a caller with us. And caller, you're up next. You're on the air with Russell Singleton from Tripp Family Medicine. Go ahead.
About a month ago, Judge Janine Pearl on Fox TV said she wore a wig and false eyelashes while she was fighting cancer. She said a product made from uranium saved her life, and she was furious that the Clintons sold off our needed uranium.
I guess there are certain ways of fighting cancer, and that is sometimes it's the old adage, fight fire with fire.
Well, the hair loss is a common side effect of chemotherapy, and it's because these drugs, as as rough as they are, they're pretty successful at targeting cells that replicate quickly. And again, that's what cancer is. It's unregulated cell growth. So, unfortunately, though, at this point, we're not really good about choosing which rapidly dividing cells we can target. So, hair and skin cells are often victim of chemotherapy and hair falls out. The rapidly replenishing cells of the gastrointestinal tract are targeted, and that's why a lot of people have nausea and vomiting and things like that with chemo. But I think I should say too, just on that topic, that there are some medications that we know are effective, but there are also some medications or supplements, really is what I'm getting at, that we know are not effective. And I understand that a lot of folks might not agree with this, and they might not appreciate hearing it, but there are no herbal remedies to cure cancer. At least there's none that have been proven in clinical studies. And again, I understand that there's probably more than one caller out there who has a personal story, and I welcome you to share that. There has been some evidence that certain herbal supplements can help with symptoms, absolutely, but they can also interfere with treatment, like chemo, for example. So, if nothing else, just talk to your provider about what you're taking and why you want to take it.
There was a fellow I was listening to, actually happened to be in Boise, and it was on a radio station there. And he was explaining, we keep talking about a cure for cancer. And he said, excuse me, but he said, there will never be a cure for cancer because it mutates. In other words, you might find something you think is a cure, but cancer is something you can think you're in remission. And you may not have it for years, but then all of a sudden a mutation takes place again and it comes back. So he said the idea that there will ever be a cure is a little bit pie in the sky. On the other hand, this thing we're hearing about called nanotechnology, and I remember that movie when I was a kid where they went on a ship through the human body. Nanotechnology, though, could go a great distance in eliminating some of these things, even if they come back and even if they're rather virulent in their nature.
Well, I think that's a good point. And the first thing we should probably address is whether or not certain types of cancer can be cured, because again there are many different types, and in a very true sense we cure cancer every day. Skin cancer, for example, whether it's a basal cell or a squamous cell or a melanoma, at Tripp Family Medicine we excise those, and we effectively cure people of cancer. General surgeons do it, but there are a lot of cancers where the best we can expect is remission. And then we're always on the lookout for a recurrence. But that issue about mutation is interesting too, because if we're talking about a cancer that forms a tumor, that tumor usually develops because of some mutation in the cell, but then that leads to other abnormal cellular activities. It leads to other cellular mutations. You can take one tumor and find many different genetic mutations. And then at that point, you're not sure which one caused the tumor growth and which are a result of the tumor growth. And so I think there is some truth in that statement that each person's cancer, even within the broad categories of, let's say, breast cancer or lung cancer, are somewhat unique because of those various genetic mutations.
And in fact, in breast cancer, I've heard that there are actually four main types, but they're all distinct. So, it comes down to a matter of treating one out of those four in many cases.
I agree, and I also think, and I'll admit too that I'm an optimist. I think we will eventually continue to make progress and maybe even find a cure for cancer using some of these new technologies. I think, contrary to what some people may believe, there are academic institutions, there are government organizations, and yes, there are private companies working to cure cancer, because that is where there's money to be made. It's not in the healthcare providers continuing to give you these chemo drugs or perform these screenings that really don't bring back a lot of money. I think if someone could cure cancer, and they eventually will, that is where money's going to be made. And you can bet there's some entrepreneurial individual out there working on that solution right now.
We should point out we've got about 3 minutes to go. I know you had some other things on the list, and we're taking up a lot of time on some other areas of this, but some other things, high points you wanted to hit.
Yeah, let's talk maybe real quickly about a few misconceptions. So, number one, is cancer a death sentence? And the answer is no. If we look at all cancers, the 5-year survival is 66%. Some cancers, the 5-year survival is as high as 90%. So it is not a life sentence necessarily. Will sugar affect cancer? If I eat sugar, if I avoid sugar, will that affect cancer? As far as we know, the answer is no. In a lab, cancer can feed off sugar, but then so do many other body cells. There's been no human studies or evidence saying that eating more or eating less sugar will contribute to cancer. How about artificial sweeteners? Will those cause cancer? No. There was a concern about saccharin a few decades ago that has never um, really been borne out. Is cancer contagious? No, it is not. But there are viruses like HPV that cause cancer that are contagious. We screen women for HPV by doing the Pap. Did you also know that we could vaccinate against HPV. Did you know that there was a cancer that we could prevent through vaccination? Yes. It's HPV that causes cervical cancer, anal cancer, throat cancer, and many others. Just a few more here. We talked about, do cell phones cause cancer? Do living under power lines cause cancer? Does deodorant cause cancer? The answer to all those is no.
Keep using the deodorant, in other words.
Yes, please do. Please do. And then maybe as we run out of time, the last one I will add here is does my attitude affect cancer? If I've been diagnosed with cancer, is there any evidence saying that? If I'm optimistic or if I'm pessimistic, the cancer will either grow or be inhibited. And unfortunately, there is no evidence that attitude affects that. However, if this is something you're dealing with, we'd encourage you to reach out and develop that network, develop that support, because there's more to be gained than just an improved prognosis.
Got about 30 seconds left. Russell Singleton in studio with us from Tripp Family Medicine. The other part of this, the sooner you catch it, survival rate goes up.
Absolutely. Women, get your mammograms, get your pap smears. Men and women, get your colonoscopies. If you've been smoking for a long time and you're over 55, we can actually do a low-dose CT scan and screen for lung cancer. But honestly, those four, that's about it. All the other ones, ovarian cancer, prostate cancer, maybe even skin cancer, we just don't have enough evidence to say that screening works. And so we're not going to waste your money because we can't guarantee some type of result.
Quickly, again, if someone wants to contact the office, how do they go about doing that?
933-4400. Find us on Facebook. Find us on Twitter.
We will see Russell at some point in December. We just don't know what week, but...
Yeah, probably towards the end there, and I look forward to being back.
All right, super. Russell Singleton joining us this morning from Tripp Family Medicine. 9 o'clock news is on the way on Top Story on News Radio 1310, KLIX, and NewsRadio1310.com, and one more hour of the program still ahead.